Hello, everyone, and thank you for joining me for this presentation on Just Say No to Drugs and Yes to Plants and Fungi. Thank you so much for joining me today. I'm happy to share all the information that I know with you. And as of today, we are in September 2022. I just got this wonderful little piece of information sent to me, which I love. And I like to present this because so many people ask me all the time, well, if cannabis and mushrooms and these natural alternatives are so good, how come we don't ever know about it? Well, it's being kept from us. And the reason it's being kept from us is because it cost big pharma billions of dollars when we decide to not take an opioid and instead find a natural medicine that will help us instead. So this is actually a recent study that literally just came out. And it was studying what the study found is that legalizing cannabis can cost pharmaceutical companies billions in sales and market share. So every time a new state becomes legal, they lose 1.5 to 2% revenues, which doesn't sound like that big of a deal. But when they're making billions and billions of dollars, that equals like $63 million every single time a new state becomes legal in medical cannabis. So this is just going to continue to grow. So they are going to continue to put out information that either steers you the wrong way. This is why the FDA won't regulate it, not that they have time. But this is why it is just in limbo and it's up to us. This means we're making a difference. The more we turn to the original natural alternatives for our pain and disease, the healthier we're going to get because we're helping our body get better. So the reason that I decided to do this event was because I now have a relationship with tons of holistic veterinarians, integrative veterinarians, and even some conventional veterinarians, where I kept seeing a trend in the industry. And one of the things that we offer at Your Natural Dog is consultations. So myself, or another expert, depending on what you want, team up with one of our holistic veterinarians and we help you. So we have a lot of clients who either are trying to get off a prescription medication that wasn't really working, or they just want a second opinion, or they're just looking for a more holistic protocol because their dog is not doing very well. And what we found is when we would meet with these people that their dogs were on 3, 4, 5, 6 different medications and the dog wasn't doing any better and they were doing a lot worse. So we were literally one after another were doing weaning them off, getting them on a detox so that their body would get better and start feeling better and start healing itself. And I just started asking, is this normal? And then I found out that this is normal. And so I asked them, I'm like, I'm a little bit confused because I was under the impression that doctors and especially veterinarians took a Hippocratic oath to do no harm. So this is what this went ahead and looked up this oath, and this oath literally says in the oath that the physician pledges to prescribe only beneficial treatments according to his ability and judgment, to refrain from causing harm or hurt, and to live an exemplary personal and professional life. I love that little last part. But that's not what's happening. Just in case you don't know who I am, I should probably introduce myself before we continue, but I'm Angela Ardolino. I am a pet cannabis expert who also has gone down the rabbit hole on medicinal mushrooms and have been using and studying them for the past 2 years for my dogs. I'm the founder of Your Natural Dog, the podcast. I am the host, so please sign up for that. I also run a small rescue farm here in Tampa, Florida, where I rescue farm animals and senior dogs or sick dogs and help turn their lives around with natural medicines. I also run a groom and retail shop where we only sell natural food supplements and do natural grooming and baths. I am the founder and formulator of CBD Dog Health and MycoDog. CBD Dog Health being full spectrum hemp extracts for pets, salves and treats, and MycoDog being medicinal mushroom extracts specifically for dogs. I have been an advocate. I fought hard for my state of Florida to become a legal medical marijuana state. And because I was such a big advocate for cannabis and traveled all over the world teaching, learning, growing it, I was invited in 2016 to attend the University of Vermont School of Medicine's study of cannabis for its therapeutic uses and biology. So that's where I learned that pets had an endocannabinoid system just like us. And because I love them so much, that's when I decided that that's where I was going to go, that route. So since 2016, I have been practicing medical cannabis on pets with unbelievable success. So let's get back to why we no longer follow this, do no harm. Why are we stacking medications that clearly cause harm and discomfort and are hurting our animals and not helping them? Well, that's because the pet health industry is being controlled by big pharmaceuticals and the big hospitals. So here where I live, it's Banfield. They're buying up all the little shops, little veterinary practices, and coming up with something called a standard of care. So this standard of care has replaced the do no harm. And what the standard of care is the dog has this disease. Here's the protocol. This is what you do. These are the drugs you give. These are the treatments you do. Doesn't keep the animal or the patient and center. It keeps the disease, and they concentrate on the disease instead. So it's a little different. We also are seeing that a lot of these pharmaceuticals are being reclassified from human drugs to animal drugs. And that's a new trend that we're keeping an eye on. We're realizing the standard of care is they come up with these treatments and these drugs. Well, all of those cost lots of money. So it literally is profits over patients. And just to give you an example, Pfizer's animal arm is called Zoetis. And last year they made $7.8 billion. Some of the other bigger ones you see here, 4.1 billion, 5.6 billion Merck made. Bayer made 3.3 billion. These are just a few of the top ones. And it's a $1 billion industry. And you want to have to ask yourself, how the heck did that happen? Well, that's because medicine is big money. And if they follow this standard of care, then they know that's a sure thing. They know that every dog that gets this certain type of cancer will get these drugs and these treatments. But what's crazy is how many drugs there are out there and how many pharmaceuticals there are out there for pets, both that are approved by the FDA and those that are unapproved by the FDA, but they're legal to market. I don't even know what that is. And the reason that exists is because the FDA doesn't even have time to look at these drugs, see whether their clinical research or their studies are actually legitimate and actually proved anything. So they just allow them to be legally marketed as animal drugs and never prove or get FDA approval. So there are drugs that are being used on a daily basis that have never been proven effective or safe for use on our animals. So I just happened to look at this. There's literally a list online that you can look at on the FDA that lists all the unapproved drugs that are legally marketed to us. So everything from let's see, February 2022, the FDA already approved 9 of them, new drugs for dogs and cats. And these are everything from flea and tick, heartworm control, a sedative, more pain meds like we need that, more antibiotics like we need that. And I also found it interesting that one of the new drugs was a new drug from Bravecto, which recently was recalled, and the FDA actually put out a statement warning people about the neurological effects and how many dogs were being affected by it. But it's still on the market, still being sold, and now they have a new one that's coming out. So it's probably because that when that recall came out or that warning came out, Bravecto sales probably went down, and now they're creating a new drug so that they don't have to worry about that. They can make up for it. There's also over 2,200 approved drugs and thousands of unapproved drugs that are being used on our animals on a regular basis. So you have to look at how this is also something that happens in the human side. So I'm starting to see that trend, how what affects us affects our pets, both in the healthcare industry and when it comes to things like cancer and pain. So age affects them, disease, diet, exercise, just like us, it's so important to them. So what the big difference is that if I'm a pharmaceutical drug who's going to put profits before patients, it's going to be a lot easier for me to be profitable on the animal side of things, because animals, our pets, are considered property. So if I were a pharmaceutical company that made a flea and tick product that killed thousands of animals, there's literally nothing that would happen except if you were one of those people that lost your pet and you decided to sue, they would just cover your vet bills because pets are considered property, which is one of the biggest problems, I think. So if we have so much in common with our pets, what is the leading cause of death? What are the leading causes? Well, that's really funny because they both are affected the same. So both pets and us, it's, let's see, for pets, it's cancer is number 1 and heart disease is number 2. And for humans, it is heart disease is number 1 and cancer is number 2. So that is how we have so much in common with our pets. But do you know what the third reason is? Well, the third leading cause of death, and it was researched on the human side, is medical error, malpractice, prescribing of the wrong drugs, overprescribing of the wrong drugs, or just error. And when you look at the fact that the leading causes of disease or death, I'm sorry, is heart disease and cancer, and both of those are caused by lifestyle habits, meaning poor diet, lack of exercise, being overweight, and the environment that we live in. These are things that doctors and veterinarians aren't taught anything about. So how would they be able to help us if they don't know anything about diet and nutrition and exercise and toxins in our environment? They literally can't. The only thing that they know how to do in those situations is to write a prescription. So this is why it's so important that we look at this, because this is the third leading cause of death for humans. For pets, it's what we have found is kidney disease, which is because so many pets are on a overprocessed, dehydrated kibble diet. And nobody bothered to do research to find out what the leading cause is and if it's malpractice. But since we have everything else in common with them, I would bet all my money that it is. And it's interesting because when you go to look at it, I went down a nice little rabbit hole with the FDA, who actually did acknowledge that there is a huge problem with accidental death, and that the leading cause of accidental death is prescription drug overdose, both for animals and humans. And in animals, the FDA actually put out a warning where there is a huge problem of animal drugs and human drugs, and some animals getting a human drug and not the right drug, or too much of a human drug, and how the names are different, how some overlap. So it's extremely confusing, especially to us pet parents, to know which ones are safe, what they should get. So we have to be vigilant when it comes to giving our dogs any of these medications. And there's also actually a training video training police officers how to give their police dogs Narcan, because they're coming across fentanyl so much on the streets and overdosing. So the human opioid epidemic is affecting the dogs also. So what is my reasoning for doing all this? Well, this is Nina, my Doberman, who had osteosarcoma, which I'm going to tell you about her whole story. But it started with my first dog, Lucy, when she started having diarrhea and throwing up at the age of 7. And I took her to my conventional vet, who I had already been feeding the kibble food that they told me was the best food to feed her. I vaccinated her, all the vaccinations every single year, which I now know I should not have done. She was given the flea and tick poison meds every single month. And I now know what happened to Lucy. But back then, this is about 20 years ago now, I spent over $15,000 trying to figure out and saving my poor dog. And I didn't. I lost her anyway. And when I went and got a autopsy so that I could find out what was happening, they only found irritable bowel. So that kind of sent me down this journey of trying to figure out what happened to my dog. Why did I literally do everything that the doctor told me to do? And she's gone at age 7, and now I'm broke. So that's where it started. Nina is probably my biggest success story. And when she was diagnosed with osteosarcoma, this was my opportunity to really prove what natural medicines can do. So I just wanted to tell you why the reason is that I'm doing this. I feel like I have 2 goals. And the first goal is to educate pet parents about the truth and to know and trust their guts, because they do know better, and that there are natural alternatives that have worked for thousands and thousands of years. And my second goal is to put a dent in big pharma and get some of these drugs out of veterinary practices, and for more veterinarians to be able to trust and prescribe natural alternatives instead of these drugs that cause harm and don't do good. So just wanted to share that really quick. So now we're going to go into where some of these drugs we have a problem. They're being overused in veterinary practices. And one of the ones that we saw the most is antibiotics. When veterinarians don't know what's happening or what's wrong, they literally turn to an antibiotic. So that's what happened to Lucy. She had diarrhea, and the first thing to do is they give your dog metrozynodol, I think it's called, which is an antibiotic or a knockoff of something like that, which literally makes no sense. Like, shouldn't we see if it's a bacterial infection or issue before we start prescribing an antibiotic? Because that causes more harm than good. The Centers of Disease Control and Prevention, the CDC, actually calls the overuse of antibiotics one of the world's most pressing public health problems. And that is because we now have super bacteria, MRSA, where nothing works to get rid of it. And it's really dangerous. So these are some of the effects of overuse of antibiotics. So avoid them at all costs, unless you have an actual bacterial infection or something, a bacteria that shouldn't be there, because we've got lots of good bacteria living in our gut. And when you or your pet takes an antibiotic, it starts to destroy that gut microflora. And that's where their immune system lives. So it's very important for you not to overuse them and not give them to your dog when they're not even needed in the first place. So bacterial resistance or antibiotic resistance is what starts to happen when we start overusing these antibiotics. Long-term effects of the beneficial bacteria in their guts, sometimes it never recovers. Sometimes it takes a really long time to recover. And that entire time, you're putting your dog is more susceptible to disease that it can't fight off. So overuse of antibiotics could be fueling the dramatic increase also in things like obesity, diabetes, inflammatory bowel disease, which is what my dog was, they found in the autopsy. So that makes a lot of sense. Allergies and asthma have doubled in recent years because of the overuse of antibiotics. So avoid those antibiotics. Ask, why should I give these antibiotics? What is it going to help? And what is the bacterial infection that this is going to help with? Steroids. Steroids are the other thing, especially when it comes to pain or seizures. I see it working all the time, or allergies. And steroids will do the trick. And we have to remember that things like antibiotics and steroids, or even pain meds, were something that was supposed to be used to stop the problem and then find out what the issue is, the underlying issue. What is causing that pain? What is causing that inflammation? What is causing that infection? And then taking care of it. None of these were supposed to be used long term, because all of them have horrible long term effects on us, on our dogs. So steroids basically suppress the immune system, because a lot of times if we're having inflammation or a reaction, allergic reaction, it is our immune system overreacting. So it suppresses our immune system so that reaction, that itch, that irritation stops, which is fine. It brings relief, but it doesn't solve the problem. So it also has side effects. So everything from short term, from panting, vomiting, diarrhea, increased hunger, energy loss. I remember with Lucy, she would get steroids and feel really good for a couple hours and then start crashing and being weird, aggressive. It opens you up to fungal infections, there's skin infections, they gain weight. And long-term use has already been linked to Cushing's disease, cataracts, diabetes, pancreatitis. So all of these things that we are seeing our older pets suffer from, a lot of times it was because of overuse of steroids. So this is, and then if they have been on it a long time, they need to be gradually taken off of it. So steroids are dangerous. And like I said, they have been prescribed for everything, every autoimmune disease, COPD, Crohn's disease, IBD, it's just like antibiotics. It's overprescribed and used for everything, every inflammatory condition. And now we're at the opioids. I think that the most disturbing thing about this is that most of the pain meds that our dogs are given don't work on pain in the first place. So it breaks my heart when I see that not only are they given one, but they're given 4 or 5. And a lot of times there's 2 reasons for this, but a lot of times is they give you one and it doesn't work, so they give you another one. Why they don't stop giving you that first one is beyond me. But the other reason is because there's 5 pathways to pain. So there's 5 different drugs that target each of those pathways of pain. So they think that if you're targeting all 5 of those pathways, then your dog is not going to experience pain. And that's not the case at all. They also don't keep in consideration all of the side effects of all 5 of those drugs, and that they have no idea what would happen when you start stacking them and putting them all together. So overdosing is a major problem with these NSAIDs, opioids, and it's extreme. They're all synthetic. So it's extremely hard on the liver and kidneys. They have to do something with those synthetic drugs and get rid of them. That means that the liver and kidneys aren't doing what they're supposed to in our body. They're too busy dealing with these synthetic drugs. So it is a huge problem. Opioids shut down the respiratory center in the brainstem, which stops breathing. They're even stronger because they are synthetic. So a lot of them are based in something found in nature, but they just take one of those compounds and make it super strong. And they're extremely addictive and potent. So just like they affect us, they affect our pets. And they now have been proven to cause cancer metastasis. So while you have a pet that's suffering from like let's say, a bone cancer and osteosarcoma, and you're also giving them 4 or 5 opioids, you're actually helping that cancer metastasize while you're supposedly getting rid of the pain. So overprescribing is a huge problem. Many people, like I said, are getting 4 or 5 drugs. In the human side of things, we're seeing up to 15. I literally know 3 people whose elderly parents are on 15 medications. It's crazy. But in the animal world, the most common that we're seeing are gabapentin, trazodone, tramadol. I don't even know how to say that one, those others, and NSAIDs. Um, and the overuse is crazy. This was a piece of research done just showing out of 697 veterinarians how many of them were using these drugs on a regular basis, not only in their clinics, but being sent home with the pet parent to give to their pets. And not to say that all the veterinarians out there are bad and that, they're doing this because they want to hurt your pet. No, it's just like the human side of things, where a pharmaceutical company comes into the office and sells them a drug, and they make false marketing claims about it, false claims that it's completely safe, that it's safe to use with other drugs. That the research shows certain things when it's research that they conducted to prove that the drug worked. They don't know. They don't know that to not believe them or to even check with them to make sure that it's, true what they're saying. So there's also a trend. I was just at the American Holistic Veterinarian Conference, where I, spoke to one vet after another, asking them, are you seeing this issue? Are you seeing this problem? They absolutely are. They're seeing drugs like methadone that are being used, where you're like, how in the heck did methadone make it into veterinary practice? And it's not even approved, both legally or not legally, but somehow it's being used. So I actually asked a veterinarian who told me a story about her being a relief vet and going into a practice to do surgery, and she follows the protocol of the hospital, and the hospital said to use methadone, and she used methadone, and the dog's heart rate went down really low, so she canceled the surgery. And when she went to talk to him about why she did it, she said, why are you using methadone? And she was told because that hospital owned 5, 6 other hospitals, and methadone was a lot cheaper and they could buy it in bulk. And that's why they were using it. Even though it has no research, study, safety, anything to be used on animals or safe for animals. Methadone is used to get heroin addicts off of heroin. So how the heck is it being used on our pets? It makes you go, this is a overdose prevention tip. So I basically just want to encourage you guys to research the hell out of anything given to you to give to your pet. And if your dog is at a vet practice, that you're very clear with them that you want to approve all drugs, so that you can see if there's an issue yourself, because your pet's not being looked out for. This is something that you need to take responsible for. And I do have this available as a download, so that you don't have to read it all and memorize it now. So I'm just going to touch on 2 of the drugs that we're seeing abused and that have entered the human space. Dr. Josie Bugh, who's been practicing over 20 years, these were the 2 that really came across, and she was like, how, why? So gabapentin we're seeing used like crazy now, and we don't really understand. It's supposed to be used, it's being used as a pain reliever, sometimes to calm animals down, which means they're just knocking them out. And it's never been proven to do anything with pain. Gabapentin was a human drug that fell out of favor and suddenly showed up as an animal drug. even though it has caused horrible side effects in humans. It was part of the largest pharmaceutical fraud settlement in history. It has no FDA approval for the conditions it's used to treat. It hasn't been effective in a double-blind placebo-controlled trials. It may prevent the brain and nervous system from repairing itself. It has no clinical significant difference in postoperative, acute, subacute, or chronic pain was found. And this is all done in research. This is not my opinion. Greater incidences of adverse events with its use increased by 70%. And there was a 70% increase in the rate of respiratory complications post-op when combined with opioids. Results do not support routine use of gabapentinoids for management of postoperative pain in adults or osteoarthritis pain. And that additional trials were required, and they were never done. And now this drug is a drug used in pet pain now. It makes no sense. If your dog is on gabapentin, take them off of it. It's not helping them. Another one is trazodone. Trazodone was a human drug approved for the treatment of depression and anxiety in humans. And when it didn't do a really good job of doing that and was replaced by all kinds of other drugs, it suddenly was appearing in vet practices. And a lot of times it's used to calm dogs down, sedate them. It's given for a lot of times for seizures and things like that. Well, the problem with trazodone is that it has all kinds of horrible side effects also. The most important is that it does react with other opioids. It creates serotonin syndrome. It is, let's see, it has never been approved for use in animals, yet I know so many that are on it. So this is another one that we say, you're on trazodone, get your dog off of it. And don't worry, I'm going to tell you what you can give your dog instead that's all natural and will cause them no harm and work a million times better than these. So this medication overload is a huge problem. Every time I get a dog at my rescue, most of the time they're seniors and most of the times they have some sort of disease. I get them and they're on so many different medications, it makes no sense to me. This is a picture of Daisy. She was a 16, I believe, when we adopted her, and severe case of dementia. She didn't make eye contact with us. She would like walk in circles, find a corner and bark in it. She had no hair on her feet and on her tail, and she was experiencing grand mal seizures. And she was on so many pharmaceutical drugs, special shampoos, sprays, you name it. And we took them off, detoxed her, took her off all of them, and put her on a full spectrum hemp extract regimen, on a biologically appropriate diet, gently cooked diet. And we watched this dog turn into a dog and enjoy her life and make eye contact with us, and then want love and give love and stop being lost. No, we got her seizures completely under control with 100 milligrams of full spectrum hemp extract, and she weighed like 5 pounds. So this is, and she lived for another 2 years. She was 18 when she passed. But these are the type of things that I've been doing since 2016. So when people say to me that THC is dangerous for pets, or, it's not good for dogs, I have case after case, and I can show you where that's not correct. So remember that stacking these medications and using them, it's causing more harm and benefit. And we need to remember that, because these pets can't tell us when they're not feeling good or when they're having an adverse reaction. So I want to remind you that you know what's best for your pet. So do your research. Don't take anyone's advice, not even mine, for granted. Do it. Make sure it's true. Check out those products, check out those drugs, and don't assume that just because a veterinarian told you to do it, that is the best thing for your pet. So I feel like we've learned a lot and now we need to unlearn. I uh, I borrow this from Rodney Habib at his latest talk. He brought this up where we learned certain things and that they're supposed to be a certain way, and it's not that. And so we have to unlearn them. And some of the things we learned was that veterinarians know what's best for our pets. And that's not true. Not all veterinarians know what's best because they haven't trained themselves in diet or in nutrition or in functional medicine or alternative treatments like acupuncture or chiropractic or herbal medicine that has existed, Chinese, Ayurvedic, you name it. So that's why I always recommend an integrative or holistic veterinarian who not only went through conventional school, but went and kept on going through training so that they understood how to take care of your entire animal. We also learned that pharmaceuticals are pure and the best for treating us when we're diagnosed with a disease. We now know that that's not the truth. And we also assumed that if a food or drug was on the shelf for sale, that it was safe and that it was something that really worked for those things and that we didn't have to worry about it actually causing more harm. We know none of this is true now. We know that veterinarians aren't taught about diet, nutrition, or natural medicines, that all pharmaceuticals are actually derived from a plant or fungi in the first place, but they occur in nature, so they can't get a patent on them and make billions of dollars on them. So they literally take one compound of that natural remedy and patent it and make billions of dollars on it. And the FDA, even if they wanted to or were able to, they're unable to even keep up with what human drugs are doing, much less what's going on in the pet industry. So to say that the FDA or any association that is attempting to oversee supplements and drugs in the animal market, they cannot do it. It's impossible. So we have to do it. So let's go back to nature because that's what's not going to hurt us or cause any harm. And I'm going to start with the cannabis plant since it's my favorite and what I'm an expert in and what I went to school for to study. So a lot of people don't understand the difference between marijuana and hemp. Well, I'm going to tell you. So the one of the issues is that nobody even knows what the definitions of marijuana and hemp are. But marijuana and hemp both belong to the cannabis plant. They are a cannabis plant, and if the cannabis plant has more of the compound THC, it therefore has less CBD, and it is known as marijuana. If the cannabis plant happens to have more CBD and therefore has less THC and is defined as hemp. So there are thousands of strains of cannabis, and some of them will fall under marijuana and some of them will fall under hemp. What we give our pets is hemp because they're have already been proven to be more sensitive. They have more receptors in their brain and on their spinal cord and their central nervous system than we do. So that's why they are such good candidates for hemp because it has less than THC. But in the human medicine, we usually need to get over to marijuana because we don't have as many receptors and therefore need more of the THC. So that is the difference between marijuana and hemp. So what we're talking about today is hemp. I did give Nina, my Doberman, marijuana, so a THC, which I'll explain to you later. But now I'm going to describe the hemp flower. And the reason why I'm telling you this is because you have to be educated on how to choose a full spectrum product because it is completely unregulated and it probably never will be regulated. And you need to know the difference so that you know that you're getting an actual medicine and not just hemp seed oil or just an oil in the bottle that has so little full spectrum hemp extract in it that it won't make a difference. But we only take the medicine from the hemp flower, which is where all of the cannabinoids, terpenes, flavonoids, all the medicinal properties live. It is also important to get all those properties together, because that's when the medicine actually works, is when it has all the compounds that lived in that flower together. So we literally extract with CO2 extraction, um, all of those medicinal properties out of the flower. And you can see all of the wonderful things, vitamins, um, all kinds of flavonoids. Quercetin is in a hemp flower. So it's very important that the extraction is taken from the hemp flower. And these compounds in the hemp flower, the cannabinoids, the terpenes, the flavonoids, they interact with our endocannabinoid system. All of us have it. Every animal has an endocannabinoid system. And this endocannabinoid system has two receptors, CB1 receptors and CB2 receptors, which are throughout the body. You can find the CB1 receptors throughout the brain, lungs, muscles, CB2 receptors in the spleen, bones, and they're literally all throughout the immune system, the liver, the bone marrow, brain stem, and the compounds in the hemp plant interact with these receptors. So when you're feeling pain, or something's not operating right, the endocannabinoid system has a deficiency. And the endocannabinoid system is the master system in our pets, in our body and our pet's body. That means it is responsible for all of the other systems and keeping them in balance or homeostasis. So when you have a deficiency, or your endocannabinoid system is not operating correctly, you can literally take the hemp plant's compounds and help with those deficiencies and fix your issues. So that's why it helps so many things, is because it interacts with the master system in our body. Our pets also have receptors all throughout the brain. So everything from the hippocampus, where memory is stored and they recall, to motor skills, and where they're controlled, where learning is. So it's all throughout their brain, and it's extremely beneficial as a neuroprotectant also. So what is a full spectrum? Because a lot of you are going to hear about broad spectrum products or isolates. A full spectrum is what I said before, where they extract all of the compounds out of the flower, meaning those cannabinoids, the terpenes, the flavonoids, all of those compounds are extracted together. That way you get something called the entourage effect, where everything is together and works as intended. A broad spectrum product is when they take out the THC, or it's just not detectable on a lab test. That is another process that the extraction process has to do. And therefore, you don't just take out the THC, you take some of the other beneficial compounds also. And dogs are perfectly safe on THC or taking THC. Nobody has ever died from consuming a full spectrum or a full cannabis marijuana product with THC in it. They actually did a study in 1973 to see how much THC it would take to kill a person. And of course, they did the research on animals, and no chimpanzees or beagles in the experiment died, and they gave them 9,000 milligrams of THC. So nobody's ever died from THC, but broad spectrum exists in the marketplace because it was launched before the Farm Bill, and that's how you got ahead. An isolate is when they take just one of these major cannabinoids that you see listed here, like CBD, and they just take it by itself. Well, all of the benefits that you're going to hear me talk about and that you've read about are only on full spectrum products. Full spectrum products are the only ones that have been researched and have been proven to do all the things we say that it does. Not an isolate. One day isolates may be useful after we've researched for specific things, but for now, make sure that you are using a full spectrum product. And this is why these cannabinoids are extremely powerful, and they all have their job, and they all work better when they're together. So CBD, for instance, all of them, most of them are antioxidants, but CBD is an antioxidant. It can decrease seizures. It increases appetite. It's a muscle relaxant. It reduces anxiety. You have CBC, that's an antibacterial. CBG is an antibacterial, an antiarrhythmic, an anti-inflammatory, a bone stimulant. To CBN, which is analgesic, anesthetic, antioxidant, anti-anxiety. So it's very important for all of these to be in your medicine. And that's just the cannabinoids, which currently they have discovered 114. They're going to find more. Every time I go to a cannabis event, they have discovered another one. Terpenes are what give plants their smell, their flavor, but they also have medicinal properties themselves. So making sure that we have as many of those terpenes available. And remember, every strain of hemp is different. So that's why you're always going to have a different makeup of these cannabinoids and terpenes and flavonoids. But all of them have medicinal properties. And these medicinal properties are what's found in a lot of other adaptogens. Adaptogens being plants that have medicinal properties, that when we take them in our body, they literally adapt to what we need. And when you put more than one adaptogen together, they become very powerful. So turmeric, frankincense, both share B-caryophyllene, which has been known to be antibacterial, anti-inflammatory, antifungal, helps with pain relief tremendously, as an anti-cancer drug, is because this terpene is in both cannabis, frankincense, and turmeric. So that's why these other plants and roots and mushrooms that exist in nature, they have share some of the same properties, and they all interact with the endocannabinoid system. That's why they're so magical. So that's also why hemp has so many benefits for pets. Everything from protecting the brain, being an antioxidant, working as an anti-cancer agent, helping to either support the immune system, whether it needs to stimulate it or needs to suppress it because it's overreacting to something. Great for the spinal cord, great for allergies, the eyes, the heart. We have the receptors in all these organs, and that's why it works so well for all of them. So we're going to start with pain. Pain is, how I discovered the medicine myself. I was diagnosed with rheumatoid arthritis and didn't want to take the prescription medication that was prescribed that had already been linked to lymphoma. So I started my journey to find what I could. I lived a pretty natural lifestyle anyway. So I was like, all right, well, let's see what I can find that'll help me with my arthritic pain. And I found cannabis, and I could not believe how much it helped not only my pain, but my mood. I was so less stressed, more calm. I couldn't believe what an effect it had on me. So that's kind of how I started my journey. And my actual first formulation was the Ease tincture, which I made for my schnauzer, Odie, who's now 16 years old. But at 9 years old, he all of a sudden wouldn't go up the steps anymore, and kind of looked at me like, I can't do this. Of course, I took him to the vet, and she was an integrative vet. And I mean, everything from, she told me she was pretty sure it was degenerative myelopathy. There may be a brain tumor, all kinds of things. What I wasn't told, and what so many of us are not told, is that my dog was 9, which means he was a senior citizen and experiencing old age like we do, and had arthritic pain. So I created this tincture with him, which is a full spectrum, 550 milligrams of a full spectrum hemp extract, frankincense, and turmeric, since they all three are adaptogens, along with hemp seed oil and MCT oil to help with absorption. And I gave that to him, and my little 9-year-old started running up the steps again. So there's no denying it. There's no placebo effect with pets. So when you give them the right dose of a potent hemp extract, you will see results pretty quick. They immediately start feeling better because pain literally lifts from them. Any of you who have tried cannabis for yourself for pain know this feeling. Well, our pets feel it even more. So it is amazing for pain. And Odie is 16 now, and he still is, he takes a full dropper of Heal every single night before he goes to bed. Sometimes during the day, I'll give him Ease, but he is still on it and still thriving. And we've already got proof that cannabis works for pain, not only in humans, but in pets. So we have numerous studies on cannabinoids like THC, CBD, CBC, and CBG all working on pain when they're together, of course. We have plenty of clinical studies that show that cannabinoids work, and there's over 28 randomized clinical trials that have already showed it. So every way that pain, those five pathways to pain are all taken care of if you take a cannabis and mix it with another adaptogen. So they take the place of an NSAID, and everything. NSAIDs are usually prescribed, or opioids, for different types of pains, whether it is arthritis, whether it's the pancreas, pancreatitis, periodontal disease, neuropathic pain, bone cancer. A full spectrum hemp extract can take the place of those. And everything, because it operates, it reacts with the CB1 receptor. It helps modulate them. It helps the CB1 and CB2, like I said, is throughout the whole nervous system. So it expresses the CB1 and CB2 receptors when it needs to. They modulate neural conduction of pain signals through the activation of cannabinoid receptors. And those receptors are throughout their whole body. So wherever they're experiencing pain, it's going to take care of it. So we already see that a full spectrum hemp extract or marijuana extract shows that it is amazing on the canine inflammatory response. It shows that it helps dogs with osteoarthritis. CBD, CBC, CBG, terpenoids, and flavonoids produce an analgesia in animals. They both contain omega-3 and 6. And THC has been proven to work on chronic and extreme pain. And I can attest to that because Nina took 10 milligrams of THC for her osteosarcoma, and it controlled her pain. I never gave her a pharmaceutical drug for her pain. I completely was able to control it naturally. So let's talk about cancer now. This is Nina, my Doberman. It's at Adder Lake in Florida. But cancer has become the monster that I have taken on because of her. And she is she was my third case of cancer here on my rescue farm. But 1 in 5 dogs is going to get some sort of cancer, and 1 in 9 large breed dogs is going to get osteosarcoma. And osteosarcoma is a monster. So what I was offered, even when Nina was diagnosed, was you are offered the removal of the tumor or amputation. You are offered radiation, chemotherapy. All of this is anywhere from $5,000 to $20,000. And you could only have your dog for 4 or 6 months. So I don't know about you, that was not an option for me. Also, I wanted to see, everyone's always asking me, where's the research? Where's the research? Which now I'm so happy I can actually provide it. But back in 2016, I couldn't because it was illegal. So we couldn't research it. So I was like, okay, well, let me see the research on chemotherapy and radiation. Well, this is what we found. We find that amputation and or limb sparing adds about 60 to 120 days to their lifespan if you were just going to do that. And that's anywhere from $2,500 to $10,000. Amputation and chemotherapy, you get about 300 extra days with your dog. That's anywhere from 4,000 to 20,000. Amputation, chemotherapy, and radiation, you get about 320 days. And now we've got immunotherapy. And this one, 7 out of the 10 dogs got an extra 365 days. 5 of them lived past 500 days. The 3 pieces of research that showed the others, most of the dogs died, but the few that survived, which I want to say was like 12 of them, it was a very small number. That's what they found. Versus what I did. I did no amputation, no chemotherapy, no radiation, and my dog lived 850 days. And I went ahead and calculated how much I spent on caring for her in an entire year. Because I often get the argument at my store that raw food or a freeze-dried diet is too expensive to feed your dog. When I want to say, well, you're going to benefit later when they get sick and their immune system is so strong and can help them battle something like cancer. So I went ahead and calculated that between all the treatments, meaning acupuncture, ozone, chiropractic, that I did on Nina was $4,200. I spend about $3,400 on all of her food and treats, and about $3,000 a year on all of her all natural supplements. So a total of $10,000 for her complete care, and for her cancer and overall. And I got her for 500 more days, almost 500 more days than all of the other conventional treatments. Also, I want everyone to realize that veterinary oncology is new. It is not that old. And as you can see from this piece of research, it's already huge money, meaning everything that we're seeing on the human side of things, we're going to start seeing as offerings for our pets. So already in 2021, the veterinary oncology market was at $95.5 million. So I can assure you now it's already in the billions. And now you're just going to be bombarded with drugs and vaccines and treatments for your dog's cancer. This was a piece of research that I found reviewing to see even if chemotherapy was ethical to give to a pet, since the pet can't say, this hurts, I don't feel good, I don't know what's going on. So they found that it wasn't ethical to give a dog chemotherapy. And if you don't know what chemotherapy is, look it up. It's literally poison that you're taking that kills not only the bad cells, but the good cells. And guess what? There are things that you can take that are natural that will kill the cancer cells and not the good cells. So this is something that is possible to do. And now we're hearing about immunotherapy. Immunotherapy is a treatment that uses a pet's own immune system to fight cancer. It can boost or change how the immune system works so it can find and attack cancer cells. That's literally what plant and fungi medicine do. They support the animal's immune system to help them fight off the cancer themselves. So skip that. So chemo versus plants, conventional versus nature. What many of you may not know is that cancer has 12 signaling pathways, which it uses to grow, replicate, and spread throughout the body. You're going to hear a lot about in the human side of things, these targeted chemotherapy drugs, meaning if it's breast cancer, then they know that this certain pathway is where breast cancer is able to proliferate. So they make a drug that stops it in that pathway. So it deals with one pathway at a time. When cannabis, on the other hand, has already been proven to interact with 8 of the 12 pathways. So not sure why we would take a pharmaceutical drug that also has all of these side effects: destruction of the healthy cells, the gut microbiome destruction, immune system permanent damage, no appetite, no energy, depressed, and then a lot of times we lose them anyway, when we can go to cannabis that interacts with 8, and the side effects are static ataxia, which means they may be hot, get a little high, urinary incontinence, which I was able to completely control by giving my dog CBD, increased appetite, increased energy, and great mood. So let's talk about these pathways. These pathways have already been discovered in cancer, and cannabinoids have already been researched and proven to work in these pathways as anti-cancer drugs. So cannabinoids as inhibitors of tumor growth and spread has been demonstrated in preclinical studies. And this is how it works. I'm going to show you. So what you're seeing in these three columns is you're seeing the pathways. So the red means that they stopped something in the pathway. The blue means they downgraded it. Sometimes they're up regulating it. And this is the cannabinoids and all of the compounds inside of cannabis. Sometimes CBD will be doing something in one pathway, meaning down regulating something, while a protein found in cannabis can actually be stopping something else. So again, why it's so important to have a full spectrum cannabis product, whether it be hemp or marijuana, so that you can do this. But this is what has already been proven, that in the proliferation of meaning the cells keep dividing and getting bigger and taking over, that the cannabinoids stop the proliferation of the cancer. So they cannot do that. They cannot spread anymore. That's what this left column is showing. The middle column is showing that it actually causes death, apoptosis, meaning cell death. It kills the cell. And on the third column, this pathway is something called autophagy, which means once the cannabinoids have done their job and killed these cancer cells, autophagy is the body helping the body get rid of those dead cells and remove them from the body so that they're no longer there. So all of these have already been proven that cannabinoids do these three actions in those pathways. And I'm not done. Also stops the spread, the metastasis of cancer. It also prevents other cells from turning into cancer cells. That's what the middle one is showing. And then the last one is one of my favorites, tumor angiogenesis. This is THC, for instance. So I don't know if you know this, but a tumor forms one cell, a rogue cell, abnormal cell gets with another abnormal cell, and then another one, and now you have a tumor. And once a tumor is formed, it literally shoots out a vein that attaches to one of our blood vessels where it is fed and gets everything that it needs. THC literally comes in and cuts off that blood supply. So it literally starves them so that they die. So these are all 12 of those pathways and what cannabinoids do in those pathways on cancer. So why wouldn't you take cannabis or give your pet cannabis for cancer? This slide is showing you what the cannabinoids do to help the immune system fight off the cancer. So unlike chemotherapy, where chemotherapy damages and poisons the immune system, suppresses it, doesn't allow it to do what it's supposed to do, cannabinoids actually help it and enhance it. So everything from blocking the response of a T cell to enhancing a T cell response. So all of these are pathways that are being blocked or enhanced to help the animal's own body fight off the cancer. And not only that, on top of that, you get a happier pet. It's hungry because it's stimulating its appetite, which we all know getting a sick animal to eat is not easy to do. And let's not forget about the pain relief that it provides. So just say no to drugs and yes to plants and fungi, because they literally can bring you the relief you need and help your immune system fight the cancer. So let's talk about medicinal mushrooms. The reason that medicinal mushrooms are so incredible is because they interact with the endocannabinoid system. They are adaptogens, just like cannabis are, just like turmeric is, and frankincense, and ashwagandha, and astragalus root, and bacopa monnieri. All of these herbs that you love and have heard about and that sound incredible, they are that way because they share a lot of the same compounds. terpenes and flavonoids, and they interact with the endocannabinoid system. That's why they're so magical. But we already have all of the research proving that medicinal mushrooms are also amazing anti-cancer agents, and that they also help the immune system fight off the cancer, that they're antioxidants, that they cause apoptosis and kill the cancer cells. So if you have cannabis and medicinal mushrooms and a good diet, you are literally doing everything you could to help that animal's immune system fight off the cancer. Cannabis and mushrooms alone will interact with all 12 of those pathways. And it's incredible. It's better than what any cancer drug can do. And don't worry, this is available for downloads so that you don't have to try to memorize it. But these are two mushroom guides that we created and took all the research, because of course I was developing my own mushroom tinctures for Nina when she was diagnosed. So I wanted to see not only what mushrooms already had the research to have, that they had anti-cancer, anti-tumor properties, immune stimulating properties, and could I source them here in the United States? And so this is where all this information came from. So on the left-hand side, you can see some of the most popular medicinal mushrooms and what their properties are and how they help us and our animals. And then on the right-hand side are the mushrooms and what cancers they have already been proven to help with. So both of these are available for download on my website for you to refer to them. But mushrooms, again, are like cannabis, where they are unregulated. So choosing a product, there's actually more bad mushroom products on the market than there are cannabis products, believe it or not. And that is because mushrooms have to grow on something dead or grow on a tree. And what happens is most people are growing them on a substrate. So it's a little square of, some sort of grain with mycelium that then the fruiting body blooms out of. And right when it sticks its head up, they take that entire substrate and grind that up and put it either in a tincture or in a powder form. Well, the problem with that is that would be like me crushing up the hemp flower and putting it in an envelope and selling it to you as a full spectrum hemp extract. Nothing has been extracted yet. So you need to make sure that you have a true extraction of the fruiting body, meaning just the little part of the mushroom that you are familiar with, like the flower, like the hemp flower, and that is then taken and extracted. The medicinal properties are extracted from that. If it's a powder, the powder is a freeze-dried version of the extraction. And if it's in a tincture, like mine are, then it is put in organic glycerin, which is a safe preservative, and put in a bottle. And the reason that I went ahead and created this is because I was giving her, let's see, 1, 2, 3, 4, 5, 6, 7, 8, giving Nina 8 mushrooms a day. So when putting 8 extract powders in her food, it became muddy and gross, and she'd stop eating her food or working around it. So I put them all in a tincture so that I could give her the tincture full every single day and know that she got the medicinal mushrooms she needed to help fight her cancer. The other thing about mushrooms is that they're like hemp, where they're bioaccumulators, meaning they suck everything out of the earth and air. And it's very important where they're grown is not polluted. So hemp, for instance, is safe because it's grown under the Farm Bill, and the Farm Bill makes it grown with no pesticides or herbicides or all of those things. Mushrooms don't need that, but because people are growing them on substrate or where they're not really supposed to, or are growing them in a toxic or polluted place, it's very important to know where they came from and how they're grown. If it's supposed to be on a birch tree, let's say, for instance, like chaga literally will not have the medicinal properties that it's, touted to have and will help us with unless it's grown on a birch tree. So knowing where they're growing them, who they're coming from. And I'm telling you now, I only know probably 3 or 4 products on the market that are done the right way. Of course, mine, which are a liquid tinctures, and Namix, or real mushrooms, who extracts it and freeze dries the powder and puts them in capsules or a powder. So it's very important that the product is an actual extraction, whether it's dual or triple extracted with hot water, or when in the case of reishi, that it is alcohol was used to pull out the medicinal compounds. But make sure that you're getting a true extraction. Most things are just ground up mycelium substrate and very little of the medicinal properties. So I ask you, what would you do if you got the cancer diagnosis for your pet? I want you to believe the diagnosis, but not the prognosis, because the prognosis is now up to you now that you know better. This is what I did. So these are 3 of my cancer cases. Nina, my 8-year-old Doberman who was diagnosed with osteosarcoma. Daisy, my 14-year-old who was diagnosed with mast cell. She had a tumor on her spine. And Potato, who was 14 years old, had lymphoma, B-cell lymphoma, and Cushing's disease. And this is what I did for each of them. Nina was diagnosed in May of 2020. I'm sorry, she started limping in May of 2020 and diagnosed in June of 2020 and given till December to live. This is actually a picture of her at 22 months, I believe. And this is actually when we got her leg amputated. So she was at 2 years old. So the prognosis was not correct. And you can see how the osteosarcoma completely destroyed the bone in her wrist. This is her actually the day before we had the leg amputated 2 years later, because as you can see, it started to cut off blood flow to her foot, and it actually created another tumor where fluid was collecting. So this was started to really bother her, and we could really tell that she was getting tired of it. So we knew it was time to get her leg amputated. But she beat all records. I had vets that could not believe it, were shocked. We still haven't met another patient who has lived past a senior dog without getting any of the conventional treatments living this long. She was happy and running and thriving the entire time, which was the most beautiful thing. And you usually don't get that when your dogs are on a chemotherapy or on lots of pain meds. But we gave her 80 milligrams of a full spectrum hemp extract. We actually used our horse ease tincture, which is the same formulation as the dog and cat, but it has a lot more full spectrum hemp extract. So we wanted to make sure that she got high doses of that, along with the frankincense and turmeric that's in it. And we gave her the Vitality mushroom tincture, which is a mixture of turkey tail. These are all mushrooms that have already been proven to have anti-cancer activity and, of course, support the immune system. So turkey tail, reishi, cordyceps, shiitake, maitake, artist conch, which is a lot like reishi, and red belted conch. So that's all of the mushrooms that are in the Vitality mushroom tincture. We put the Remedy full spectrum hemp salve that also has eucalyptus and peppermint on the actual tumor, and actually on her other leg too, since it was doing all the support now to bring any relief that it did to that. Anything on the skin of a dog has 3 layers of skin, and both the CB1 and CB2 receptors are found on each layer. So any skin condition is extremely beneficial for you to put on a full spectrum hemp salve. It does wonders. Not only does it bring instant relief, but it actually helps get rid of whatever the irritation is. And of course, in the mushroom tincture, we also have ashwagandha and astragalus root, which are both incredible adaptogens, which just help make the cannabis and mushrooms more powerful and do their job even better. And then, of course, a ketogenic diet of cool proteins. So rabbit, turkey, duck, sometimes some fish, to help support um, her gut where her immune system lives. So, uh, uh, what was the craziest thing is that 2 years after her diagnosis, when we finally did the amputation, we had 8 different diagnostic tests done on her before we amputated the leg. This is her x-rays of her chest. And what you can see is that 2 years later, the cancer still had not spread. And those of you who have experience with osteosarcoma know that it spreads from the primary tumor. Like all cancers, it's a primary tumor that starts somewhere and then spread. So osteosarcoma, it started in her wrist and it never moved from her wrist. So we had live blood analysis, blood test, everything, and nothing showed that it looked like she didn't even have cancer. So I think that was what like shocked veterinarians the most. I remember taking her in at 18 months and they were like, can we go ahead and x-ray every part of her? We won't charge you because we need to document this to show that it still hasn't spread. And that was at 18 months. So you can't deny it. The cancer didn't spread. It kept the cancer contained. So it makes me think that every large breed dog should be on a full spectrum hemp extract because maybe we can prevent it from ever happening in the first place. What this is the pathology report proving that it was osteosarcoma because nobody believed me that she was still alive and had osteosarcoma. So this is just proof that it was. This is Miss Daisy. Daisy was a rescue that her owner passed, and the family brought her to my shop for boarding, and then we're going to take her to the pound. And I'm like, absolutely not. So we got her, and this MCT tumor was attached to her spine. You couldn't even get under it. It was hard. And we started giving her the 42 milligrams of full spectrum hemp extract, our heal tincture, which one dropper full is 42 milligrams of a full spectrum hemp extract and hemp seed oil and MCT oil. We gave her that full dropper AM, full dropper PM, and then we put the remedy salve on her, which I don't have handy, but we put that on the tumor every day. And the pictures that you're seeing to the left is basically the tumor dying. So a lot of times when you're treating it holistically, it inflames, it gets inflamed and angry, and then it literally starts dying. A lot of times it turns black, it oozes, it bleeds. They don't feel any pain because the full spectrum is getting rid of any of the pain. And then gone, completely gone, never came back, couldn't even find it on her back anywhere. She was also dragging both her back legs. She stopped doing that. She started using her back legs, and lived for another 2 years and just was the happiest dog. We have so many videos of her where all of a sudden she's out in the lake with all the other dogs playing. So we loved her so much. We miss her so much. And this is Potato. We renamed Potato. She was Roxy, but we had another Roxy in the house already. And we renamed her Potato because she was covered in little tumors all over her body. And we got rid of every single one of them. And there were so many that I could not believe we got every single one of them. But we put remedy on every single one of them at least every other day. Sometimes you couldn't see them because her hair would grow long. But she also got 42 milligrams every day and the mixture of mushrooms. All of her symptoms of Cushing's disease completely went away. So her excessive drinking, that's actually why her owner got rid of her, is because she said she just kept peeing on everything and she couldn't handle it anymore, along with all the medications and vet bills. So we took her off all the meds. And she also, we sent her lymphoma into remission and she lived another 2 years. And these are my dogs on the farm. This is Olivia, who was one of our first customers that had this papilloma on her dog that she said was there forever. And the vet kept wanting to cut it off. And she knew better than that, not to put her dog under surgery just to cut this off. And finally, she started giving her the heal tincture following the protocol for this, putting the remedy off. In 2 weeks, it fell off. And then that's when we realized that it was also helping with Cushing's disease, because she was the first one that was like, and I don't have to get up to take her pee anymore in the middle of the night. And she's not taking as many drink breaks. Is it possible that it helped her Cushing's disease? Absolutely. Because guess what? Cushing's disease is a tumor on the adrenal or pituitary gland. And what does the full spectrum hemp extract do and medicinal mushrooms do? They shrink and kill those tumors. So when those tumors go away, the symptoms of those diseases go away. So many of you are probably wondering how much. The best thing to know about a hemp extract or a mushroom extract is that neither one of them can you overdose and cause any harm, permanent harm. The worst thing that could happen is if they had too much of hemp is that they would get sleepy and they would sleep it off. So if you're looking to just calm your dog, or your dog gets super stressful when they go to the vet office or the groomer or out for a walk, for calming, we recommend 12 milligrams. Our calming tincture also has lavender essential oil in it, so it is great for calming. And guess what? Lavender is also an adaptogen, and that's why it works so well. For pain, stiffness, joint pain, allergies, we love the Ease tincture, which is the one I showed you before, that also has turmeric and frankincense in it. And again, I recommend starting dosage would be 12 milligrams, which is a full dropper full. And of course, if your pet is older or needs more support, you can give them more. So you can give them another a dose of it if they're still suffering from joint pain. And then of course, if you're dealing with cancer, seizures, autoimmune disease, research shows 37 to 50 milligrams. For cancer, up to 100 milligrams, depending on the cancer. Nina was getting 80 milligrams of a full spectrum hemp extract. Oh, and I forgot to share that part. And she also, I live in Florida, so I would go to my medical dispensary and get her marijuana extract, full extract of marijuana oil, which had 10 milligrams of THC. I'd give her 10 milligrams of THC every night in a crude oil that I put right on her gums. So anyone tells you that THC is dangerous or will hurt a dog or cause damage, it kept my dog alive for 2 years with a severely painful, aggressive cancer. So not true. Make sure you're choosing the right brand, just like you do with the mushrooms. Make sure it's grown organically, meaning if it is grown under the Farm Bill, it is grown organically. Make sure they have good manufacturing practices, meaning how they're harvesting them. Same thing with mushrooms, being wild crafted, that they're sustainable, that they're not damaging what's going on in nature. In hemp, making sure it's being harvested at the right time, that it's the extraction process is actually getting all of the medicinal properties out. We use CO2 extraction, and that it's bioavailable. So meaning when it's being put in that bottle, when we put it into our mouth, that it's actually going to be absorbed and work. So that's all very important. Make sure there's no other ingredients in either one, mushrooms or hemp, that aren't beneficial and going to help the medicine work better. I mean, if there's anything you can't read or don't know what it is or can't pronounce, put it down. Flavorings, colorings, do not bother. Medicine doesn't have flavorings in it. Doesn't need to. It's an all natural product. And the most important thing with hemp is to make sure that it has a certificate of analysis, which will show you what is in that bottle that you're buying and also what's not in it. And of course, like always, make sure that it's a full spectrum hemp extract. The certificate of analysis is how you get to it on our products is there is a QR code on our products. And when you scan it, it takes you directly to the website The batch number is on the bottom of every single bottle. So you get a certificate from a third-party lab that shows you that this is a full spectrum hemp extract. And the way you know that is because you will see those different cannabinoids that we mentioned early, and you'll see a little blip on there showing that they're all on there. Of course, CBD being the most, but you want to make sure that a little bit of THC is in there, at least that 0.3, which is legal, and that means it's a full spectrum hemp extract. What you also see is what is not in that bottle, meaning no solvents. If they used something like alcohol or butane or whatever the heck they use, that's not in the tincture. Pesticides, herbicides, heavy metals, all the things that they can draw up out of the ground. You want to make sure none of that shows up on your COAs. If you can't find a certificate of analysis or a COA on the website of a hemp product, a full spectrum hemp extract, don't buy it. You should not have to search for it. It should be easy to find. It should match up. And if you have to call or search for it, I would go to another company. And I also wanted to remind everyone again, we're coming to a close, and I started it with showing you how big pharma is threatened by these natural alternatives because they lose millions of dollars. And I just wanted to show you this wonderful patent since 2003 that the United States government has had a patent on cannabinoids as an antioxidant and neuroprotectants. And they still will not make this federally legal so that we can all benefit easily from this medicine. So what are the takeaways? These are like my number one suggestions on having your dog live a long, healthy life where you are supporting their immune system so that you are not running to the veterinarian every time they have diarrhea or throw up. Everybody goes through that you're not causing more harm than good. So make sure you're feeding real food. It's a fresh food, and that what they need by weight. There's so many books out there. Dr. Ruth Roberts, Dr. Judy Morgan, petcarnivore.com, Kimberly Gauthier, all these people are wonderful resources for following how to feed them correctly if you want to do it on your own. If not, there's amazing food brands out there. They do get bought and changed, so make sure that you always follow that. I also always say to mix it up. Don't stick with one brand. Find 3 or 4 that you love and do it that. And then once in a while, cook for them. Make sure you exercise them regularly. Water is so important. Make sure that their water is filtered, but also has all those essential minerals that they need from their water. Supplement with natural products when you can. Don't turn to those pharmaceutical drugs or something synthetic. So just because it says all natural, do your research. Find that small boutique store, that online resource that you love, that you can trust, that you can see what they recommend if you don't have time doing your research. Avoid these toxic flea and tick meds. I can help you with those fleas. Amber necklaces work on, I would say, 80% of my dogs. If not, I've got an electric tag that gets rid of them. There is no use for you, for no reason for you to have to use those toxic chemicals and put them in or on your dog, which are going to get all over your house and all over your family, in your pool, in your lake, everywhere. So don't bother with them. They cause so much harm. Avoid antibiotics whenever you can. Just say no. Tell them you don't want them. I also have a download showing you all the natural antibiotics that exist that you can get on my website. Avoid pharmaceutical drugs or human pharmaceutical drugs or over-the-counter drugs. Benadryl is not good for dogs. Don't give it to them. Use a full spectrum hemp extract instead. No vaccinations past the first year. Just like us, we only need vaccinations the first year of life. You can ask for something called a titers test, which will actually test their antibodies to see if they actually need that vaccination in the first place. And then remember, chemicals in your yard, fertilizers, pesticides, floor cleaners, carpet cleaners, laundry detergents, all of those have toxic chemicals. Candles, plug-ins, all the things that you spray in the air. I would rather smell a dog in your house any day than a fake lavender scent. So don't bother. All of those things, their noses are right down. They inhale them and it's not good for them. and keep all pharmaceuticals and recreational marijuana products out of the reach of your pet so that nobody gets into it. And those are what I think of. This is Odie. Again, another picture of my soul dog, Odie, who's now 16. And be sure to follow me. I'm at angelaardolino.com. I'm on everything. My podcast is Your Natural Dog, where I talk to experts and holistic veterinarians from all over the world. And they talk about their incredible cases. And we try to get those stories of natural healing out as much as possible. Thank you so much for joining me. Remember, you can always reach out at angelaardolino.com or on my website or any of our social channels. And we're here, we're all educated, and we're all here to help you heal your pets naturally. Thank you, everyone.